Hi everyone, I'm Olivia Alt, and today I'm going to be talking about the economics of smoking. So, to begin with, it's important obviously to look at smoking's monetary impact, and this can be broken down in several different ways. So, the first way to look at smoking's monetary impact is to look at the loss of productivity because people have to take smoke breaks, so that means they're away from their workstations, their desks, wherever they're working. And then additionally, smoking is going to lead to illnesses, which is going to take them out of the workforce for doctor's appointments at first, but then gradually, if smoking continues and it's allowed to progress, that can lead to things such as cancer, COPD, other lung problems that will eventually take people out of the workforce permanently because will have to be home resting from all these illnesses. So that's one way that we see smoking's monetary impact as well as its health impact. In developed countries, about 15% of healthcare costs are devoted purely to smoking-related healthcare. So this is a substantial number when you're looking at the overall healthcare costs in these developed countries. This is something that is devoted to preventable diseases because people make the choice to smoke, but we'll get into how that decision can be made in a little bit. We also know now that it's more than just cancer, lung cancer, or mouth cancer that's associated with smoking. Stomach cancer has also been linked to smoking because if you're inhaling smoke and it's going down into your esophagus and it's going to be getting into your stomach and irritating it. There are also other long-term health problems that have been linked with smoking, such as diabetes, COPD, and various lung and heart problems. So, like I was saying before, all of these are going to build up so that there's lost productivity. We're going to have to devote more healthcare costs to addressing these problems. So it's all going to add up and become very expensive. And like I was saying earlier, there's going to be an increase in sick days, which means more people are going to have to come in to cover, or jobs just won't be done because people aren't there to do it. So problems such as bronchitis, dental issues, and cancers are all going to start to develop with long-term smoking. Okay, so moving on to efforts to curb smoking. Preventing smoking in the first place is going to be the most effective and the most cost-effective way to lower these monetary impacts that I was just outlining. So that's going to take place through various programs. Peer pressure is actually something that could be used in favor of this. So if it's been shown that high school students who are surrounded by peers who are also smoking, also making these risky decisions, they themselves are much more likely to start smoking themselves. But if they're surrounded by people who aren't smoking, who aren't giving into that kind of temptation, they are then less likely to start smoking. So people are copying what they're seeing, and if we can have the encouragement to make those smarter decisions and prevent it from happening in the first place through peer pressure, then that's actually a very effective way to do that. Taxes is one very big way that the country has tried to address smoking. So all the states have different ways of taxing and controlling the cost of cigarettes. So here in Indiana, the average cost of cigarettes is $5.97, which would be considered affordable compared to New York, which is $12.85. So if you look at those numbers, you can see that there's a marked increase from Indiana smoking or cigarette costs to New York. New York is actually the highest cigarette price in the country, while Indiana is right about average with that. So because of that, because it's more affordable, more Hoosiers smoke compared to New Yorkers. So about 19.2% of Indiana residents smoke, while only 12% of New Yorkers smoke because of the cost of cigarettes. So if we were to have more programs like that to increase those costs, we would likely be seeing a reduction. But here in Indiana, having a pack of cigarettes costs about $6. That's about, if you were to go out and get a grande coffee from Starbucks, so that's a lot easier for people to justify. Smoking cessation programs are incredibly effective but expensive because in order for them to work, there have to be meetings, there have to be resources, there have to be teachers and supports in place in order for it to be effective. Because if we're doing programs that aren't geared towards actually helping people get off of smoking, then it's just not going to be a wise use of resources. So smoking cessation intervention can range from things like advice, people who've quit smoking before and saying, this is what I did, here's what worked for me, to different products that can be used in conjunction with other methods such as self-help classes and support groups like I mentioned. So these nicotine cessation products can be things like nicotine gum, the patch that people can put on their arms, or even electronic cigarettes, which were originally developed to help with this, which I will touch on in another slide. So now there are some new challenges that people have to face now when we're trying to curb smoking. So electronic cigarettes, like I previously mentioned, were originally created to help adult smokers quit smoking because you can control the level of nicotine depending on the pods that you buy. So that was their original use, but that got taken over by a lot of younger kids, a lot of minors who started to smoke because they didn't have to worry about the taste, they didn't have to worry as much about the smell, so then it became a lot more appealing to younger people to start smoking. For a while there are different flavors, not strict legislation to prevent minors from getting access to these products, but now thankfully there have been state and federal laws in place to make it harder for young people to start smoking electronic cigarettes so that can help reduce that burden. And then it's also important to keep in mind that many people will have their first cigarette while they're a teenager, actually a very young teenager. A frequent age that I've seen in research was 13 to 14, so it's important to get information out to that age group about the dangers of smoking as soon as possible so that they can make the smart decision for themselves. So in the past, the way that people got information actually about the first time that the Surgeon General's report came out about the dangers of smoking was in Reader's Digest. Obviously now people aren't reading that as often, but they're turning to other digital forms of media to get their information. So platforms such as TikTok could be a very useful area for the government and other organizations to utilize to help get this information out there. So for example, if the CDC was to partner with some popular accounts, some influencers, quote unquote, to talk about the importance of avoiding smoking and then providing resources to those who want to quit if they have already started, can be a great way to spread that information because it would be digestible to the age group that needs to have it. And if we can adapt these messages to fit the new way that people take in media, it can be very effective. But we just need to make sure that it's actually being done in a way that makes sense. Because if there are cheesy ads or things that aren't catching the eye quickly enough, people are going to scroll past them and they aren't going to get the information that they need. So there are additional challenges going on. Like I had said before with peer pressure, if a high school student leaves a school in which there are little or no students that smoked, in which 25% of students smoke, so if they were to transfer that school, the likelihood of them starting to smoke raises to 14.5%, which is a huge increase. So if we can use peer pressure to help people make the right decision, to help them make the informed decision, that will go a long way. But young kids are super easily influenced by their peers. They want to fit in, they don't want to stick out. So if all of their friends are doing it and there's no one to tell them why it's not a good idea to start smoking, they're much more likely to start doing that. The price of cigarettes also plays an important role in the decisions of whether or not to start smoking. So older teenagers, 17, 18, 19, are much more likely to start to consider what the price of cigarettes would be. So if they're starting to save up for a car or going to college or whatever, they're going to look at the price of smoking. But a younger kid who doesn't fully understand all of that it's not going to play as much of a role in their decision making process. So that's again why it's important to get the messaging out earlier so that younger age groups have that information as they're growing up and learning about how the world works and what their place in it is going to be. So finally, for my discussion question, does knowing the economic impact of smoking change your own personal likelihood of starting to smoke? And do you think that it would change other people's likelihoods of starting to smoke if they fully grasped the economic impact that this has on our economy and on people themselves? Thank you so much.